I think the ingredients to a good doctor are somebody who's a good listener, somebody who's detail-oriented, and somebody who has the patience to think about all the possibilities before they take the next steps to take care of patients. I wish I had some great story about how I had a calling, but I don't. Mine was a calculated decision. I thought carefully about what I wanted to do, and I knew I loved science. I knew that was where my talents were, and I wanted to help people. And I thought, when you want to combine a passion for science with taking care of people, you become a doctor, and it's worked out fantastic for me. I work both on an outpatient basis and on an inpatient basis. Inpatient infectious diseases is a lot of sick patients, a lot of patients in the ICU, a lot of patients who have had to have surgery, and a lot of patients that have had complications from the outpatient setting. Most of what we do on an inpatient setting is patients who like I said, are very sick and they need help now. On the other hand, outpatient infectious diseases is the exact opposite. There are a number of chronic infectious conditions that we treat with the group here, ranging from HIV to hepatitis C, hepatitis B. When we take care of patients and we want them to have the best outcome, we have to seek perfection. It's important to keep that in mind as a goal when you're taking care of patients and taking the time to listen to them, to put all the pieces of the story together, to put together the lab results, and you can often get a really good or perfect outcome when you put those things together. I really enjoy when we get a lot of improvement quickly in our HIV patients. When patients are newly diagnosed and they're scared and they are affected by the stigma that affects so many HIV patients, when you see them over the course of those first 2 or 3 months and you can show them their laboratory results and how quickly they've improved, it's really satisfying. Whether it's a short-term or a long-term issue, I think we have the experience and the knowledge to take care of anybody. I think the fact that we have a training program here really enhances that, because regardless of whether you've been practicing medicine for 5 years or 30 years, having fellows and residents to teach forces you to be fresh. It forces you to read all the time and stay up to date on the latest recommendations, the latest studies that have been done. I think patients can really count on us to do the right thing for them.